Hello, I'm Brianna, an Air Force medic. I'm going to teach you how to properly insert an extraglottic airway, or an EGA. It is used in a deeply unconscious casualty with an airway obstruction or impending airway obstruction. Also remember that in casualties with facial trauma, facial burns, or a suspected inhalation injury, a nasopharyngeal airway or extraglottic airway may not be adequate to control the airway. In these instances, a surgical cricothyroidotomy may be a better option. Consider body substance isolation. If a combat lifesaver is available, direct them to assist. Inspect the upper airway for visible obstruction. Position the casualty's head in the sniffing position. Alternate position is the neutral position. Open the airway. Hyperventilate the casualty for a minimum of 30 seconds using a BVM and oxygen if available. Then select the appropriately sized EGA based on the casualty's weight. Size 4 fits most military populations. Size 3, yellow, small adult, 30 to 60 kilograms or 66 to 132 pounds. Size 4, green, medium adult, 50 to 90 kilograms or 110 to 199 pounds. Size 5, orange, large adult, greater than 90 kilograms or greater than 199 pounds. Inspect and test equipment. Lubricate the distal end of the EGA with sterile water-based lubricating jelly. Next, firmly grasp the EGA with the dominant hand along the integrated bite block. Position the EGA so that the cuff outlet is facing toward the chin. Open the mouth with a crossed or scissors finger technique. Introduce the leading soft tip into the mouth directed toward the hard palate. Now glide the device downward and backward along the hard palate with a continuous but gentle push until a definitive resistance is felt. If early resistance is encountered during insertion, remove and perform the maneuver to open the airway. Do not apply excessive force on the device during insertion. At this point, the tip of the airway should be located in the upper esophageal opening and the cuff should be located against the laryngeal framework. It is correctly positioned when the incisors are in line with the horizontal line at the middle of the integral bite block. To avoid the possibility of the device moving out of position before being secured in place, hold the EGA in the correct position until fully secured. Attach the BVM to the EGA and ventilate the casualty. Assess ventilation. Auscultate lung fields if possible. Watch for rise and fall of the chest. Auscultate the abdomen. Then secure the device to the casualty. Tape it from maxilla to maxilla. Document all findings and treatments on a DD Form 1380 TC3 casualty card and attach it to the casualty.